In Uganda, the Minister of Information, Communications Technology and National Guidance says travel bans imposed by Western countries against African states are unfortunate. Dr. Cris Baryomunsi, an epidemiologist and public health expert, says travel restrictions imposed on African countries are not based on science. His comments come after wealthy nations imposed travel restrictions on some African states. The move followed the announcement by South African authorities that the Omicron variant of COVID had been discovered in the country. Critics say it is typical of the Western approach towards Africa throughout the pandemic, including the hoarding of vaccines and other preventive measures to fight the disease. But supporters of the travel restrictions say it gives Western countries time to study the new variant and implement measures to contain it. In part 2 of this interview, Dr. Cris Baryomunsi, Uganda's Minister of Information, Communications Technology and National Guidance, talks to me about the cooperation between the country and its neighbors to combat the coronavirus and its variants.
Yes. First of all, we appreciate that countries have to impose measures to contain this COVID-19. But we know the Omicron variant, although first reported by South African scientists, it has since spread to over 30 countries in the world, including the Western world, Asia, and many other parts of the globe. It is unfortunate, and we take strong exception that the countries in the West can impose travel bans on countries only in Africa, and yet Omicron is almost everywhere. We do not think that those bans are informed by correct science. Like for us in Uganda here, we are not going to impose travel bans on any country, but rather we are going to strengthen surveillance within the country. We subject to all incoming travelers to mandatory testing for COVID-19. And once you test positive, we do genomic sequencing to understand the kind of variant that is responsible. And we have since discovered that Omicron has already entered into the country. And we manage those who test positive according to the treatment protocols that we have been using to manage COVID-19.
Well, Dr. Baryomunsi, some people are suggesting that these Western nations decided to take this action to give them time in order to understand what is going on and to ensure they are prepared for the Omicron variant. So the criticisms are unfair. How do you respond to that?
No, first of all, what we have heard is that the scientists in South Africa had taken samples from visitors, not even the local people. And therefore, the Omicron variant may not necessarily have originated from Southern Africa, but from other countries. And therefore, there are many countries also where Omicron variant has been registered in Europe, in Asia, and so forth. So if you limit the countries where you impose travel bans from Africa, then definitely you will be misunderstood. You either lift all these bans or you ban all those countries where Omicron has been reported. Otherwise, the Omicron in Africa is not special, it's not different from the Omicron being seen in the other countries in the West.
Well, Dr. Baryomunsi, why do you say this is typical of Western countries in the effort to stop or limit the spread of the coronavirus and its variants by imposing restrictions of travel from Africa?
We also saw it in the earlier stages, especially in the distribution of vaccines. We all remember stories of hoarding doses of vaccines in the Western world. And for a long time, African countries could not access the COVID-19 vaccines. Even now, the vaccination rates are still low in most of Africa because the countries in the West paid upfront and hoarded most of the vaccines. And that is not good for public health management, because if you manage the pandemic in one part of the world and you leave the other part of the world to suffer with the infections, then that's when you get these variants emerging, like Omicron, and once they spread, they will undermine all the efforts, including the Western world, where you could have made progress.
Talking about discrimination, what impact do you see as the stance of the West having on the fight to contain the spread of the disease in Africa and in Uganda in particular?
Well, I think over time, there has been that the appreciation by the people in the West that there is a need to bring Africa on board, save for these travel bans on Omicron. But we do appreciate the collaboration and partnership that we have had. For instance, we know the pharmaceutical companies which have been able to come up with the vaccines by and large from the Western world, and we have begun accessing these vaccines. So much as there are those weak areas, but in general, we do appreciate the collaboration among the scientists, but also the pharmaceutical industry, the governments. For instance, we continue to receive vaccines, including donations from some of these countries. So we generally appreciate, but we are just reminding our friends in the Western world that let's treat everybody as a human being. Whatever services are available to help us fight COVID-19, let's look at all the corners of the world if we are going to defeat COVID-19.
Dr. Cris Baryomunsi is Uganda's Minister of Information, Communications Technology and National Guidance. He spoke with me from the capital, Kampala.